La Hacienda's family is made up of about 180 people. La Hacienda's medical staff is carefully chosen for their expertise in treating addiction and also for their compassion for their patients. This includes 4 licensed physicians who are diplomats of the American Board of Addiction Medicine, in addition to their other primary boards, internal medicine and emergency medicine. When patients get there, they are assessed by the medical staff. Their assessment process includes complete history and physical assessment, biological, psychological, and social assessment, family assessment, nursing assessment, dietary assessment, psychological testing as indicated, recreational assessment, and substance abuse subtle screening inventory. La Hacienda is an inpatient treatment facility. They serve patients 18 years old and up. They separate women and men, and they also divide them by ages. They have groups of 18 to 24 years old and then 25 and up. Patients requiring detoxification are medically supervised in the special care unit 24 hours a day until the patient completes the detox process. After completing successfully the detox process, the nursing staff continues to assess the patients for residual withdrawal symptoms. Patients see one of their doctors every single day of their treatment, weekends and holidays included, because the body and mind are making daily changes. All prescribed medications are given by the nurses who evaluate them for efficacy. They use individual counseling, group counseling, didactic groups, therapeutic activities, big book studies, on and off campus 12-step meetings. They mainly use cognitive behavioral therapy to treat their patients. Needs and goals are identified early in the treatment process with a formal plan developed on the way to discharge. Within 3 to 5 weeks, patients complete most phases of residential treatment, including detox, individual counseling, group therapy, family therapy, specialized classes, activities therapy, and detailed instructions in 12-step application. At the close of the patient's visit, he or she will spend some time in silent reflection on what they have learned, and they start preparing on their transition to outpatient therapy. It is very important that each patient leaves with plans in place to address the body, mind, and spirit, including medical appointments, ongoing clinical care, and counseling, as well as 12-step program involvement. Some examples of things patients will have to consider are recovery housing, resolution of legal issues, or returning to work. La Hacienda offers activity therapy services that promote recovery by helping patients identify problems and strengths in areas critical to the recovery process. That is social involvement, stress management techniques, physical fitness, communication skills, and degree of positive self-regard. Some of the activities they offer are walking trails, on-site ropes course, they have gym equipment and 2 personal trainers, and they also have an outdoor pool. La Hacienda also has a beautiful chapel, Serenity Hill, where patients go and pray or journal, and they can also heal. La Hacienda believes that being part of a spiritual program of action while in treatment and after treatment is the best way to maintain recovery. Individuals who seek treatment for chemical dependency may also have emotional, cognitive, physical, and behavioral problems which are addressed in treatment by means of therapeutic and medical interventions. La Hacienda believes that individuals need spiritual healing as well as physical and cognitive healing, which is why their spiritual foundation of treatment is modeled after Alcoholics Anonymous. Spiritual healing takes place in facing the truth, relying on a power greater than ourselves, and working with others. Within 24 hours of admission, patients are given the Big Book, which has to be used as a guide for daily living because just reading this book won't keep an alcoholic and an addict from taking the next drink or drug. Studying the Big Book is a key component of Las Haciendas programming. It is important that patients understand the 12 steps and know how to use these tools to maintain sobriety. Ongoing recovery requires building a strong foundation through the 12 steps of Alcoholics Anonymous. While patients are there, they will work through the first 4 steps, and for some patients, it will be important to continue beyond step 4. Classes of the first 4 steps provide the opportunity to develop the understanding and insight necessary for spiritual growth based on personal honesty, open-mindedness, and willingness. It is also important to work with the patient's reservations or resistance that can come with the disease of alcoholism and drug addiction. There are 12-step meetings in and off campus where patients hear the message of recovery from the sober community. It's very important that family members get educated about addictions, how it progresses, and how they can be supportive. The goal is for the chemically dependent person to return home to a family who's educated about this disease. A new life in recovery begins with the process of letting go with love, getting rid of guilt and shame, and learning to take care of oneself. Most people affected by addiction have lost the ability to communicate honestly, or that ability has been compromised at the highest level. La Hacienda offers process groups that allow patients and their families to start communicating honestly and work on sharing thoughts and feelings openly. This is also because without knowing it, family members fuel the addiction with enabling behaviors that take them deeper into their own codependency. The topics covered are feelings and recovery, boundaries, codependency, returning home, recovery for the family, patient and family needs, 12 steps, and traditions and creating a family recovery plan. The main goal is for family members to learn how to empower rather than enable, how to take care of themselves, and how to influence rather than control. This is so important that if the program participation is not possible during the patient's treatment stay, patients have up to 1 year to return and complete the family program on an outpatient basis at no additional cost. Hacienda has a program for college kids that are between 18 to 24 years old and who are currently having problems with alcohol or drugs. And the focus of this program is to address the needs relevant to this age population. Some of the topics are chemical dependent education, dealing with peer pressure, healthy relationships, self-esteem, self-worth issues, and effective communication skills. And here are the treatment modalities that are individual counseling, daily group counseling, daily education, physician's lectures, big book, 12-step study, ropes course, family counseling. They also specialize in prescription drug dependence. Here, treatment must take into account the type of drug use and the needs of the individual. Successful treatment may incorporate several components, including detox and individual, group, and family counseling. We also have a Recovering Professionals program, which is a program designed for the people that their job requires a license, like doctors, lawyers, nurses. It is recognized that licensed persons, by the very nature of their profession, may have special issues in recovery that need to be addressed with more intense focus. Also participate in Recovering Professionals process groups, professional advocacy, community-based 12-step groups specifically for recovering professionals, and individual resource counseling. In that they do not treat psychiatric conditions as a primary diagnosis because they don't have the license to do so, but they can help patients with a history of co-occurring disorders like depression, anxiety, PTSD, or ADHD, along with primary diagnosis of a substance use disorder. They also have a relapse program. And before the recovering person starts to use alcohol or other drugs again, there is a pattern or behavior that starts with the return of denial and is marked by symptoms of isolation, depression, high levels of stress, and impaired judgment. So here with this program, patients learn to identify mistaken beliefs about relapse and their justifications and relapse warning signs. Also work through the shame, guilt, and fear associated with having been on the road of recovery and then relapsing. Patients help develop their own continuing care plans and are encouraged to find counselors and 12-step sponsors who are compatible with their relapse prevention concerns. They also have a group for those who desire to incorporate their Christian faith into their recovery. Group and individual counseling is provided, which includes recognition of the transforming power of the Holy Spirit. They also have a minister who is available for individual counseling and assistance for patients and family members. All patients need to have a plan for how to deal with ongoing obstacles to recovery, and this plan will be the foundation for staying sober. Staff works closely with case managers and other treatment team members to find the services that will meet the patient's needs. La Hacienda utilizes a great number of resources, intensive outpatient programs, extended care facilities, therapists, and physicians. Former patients participate in weekly meetings and help new graduates transition into recovery in their community. They also have a newsletter of upcoming events, speaking engagement, and recovery articles that is available online or by mail if they desire to receive it that way. La Hacienda hosts a yearly alumni reunion and invites all former patients and families.